I'm looking forward to seeing everyone at the ESPID conference this year in Geneva and virtually. My name is Ameneh. I'm an infectious diseases physician at the Children's Hospital at Westmead in Sydney, New South Wales, Australia. And I'll be giving a talk on phage therapy as options for difficult to treat infections in pediatrics. I'm looking forward to meeting everyone and hopefully having some robust discussions about what I believe is a very important new development in our battle against the AMR crisis globally. As many of you know, bacteriophages are the most diverse and abundant life form on Earth. They outnumber bacteria at least 10 to 1. They are viruses that naturally infect and kill their bacterial host, a property which can be taken advantage of to provide a novel non-antibiotic therapeutic option to treat bacterial infections. Obviously, phage therapy is not particularly novel. We've known about this for 100 years, but the older literature suffers from significant technical limitations, and it's not seen to stand up to the rigor that we now expect from drug therapy. So after 100 years in the shadow of antibiotics, with increasing antimicrobial resistance globally, there's been a resurgence in interest in phage therapy. And the community of phage therapy researchers are trying to bring phage therapy into the 21st century, taking advantage of recent advances in pathogen genomics, bioinformatics, analyses, and synthetic biology approaches. My talk will use some recent cases treated by our team at the Children's Hospital at Westmead and our collaborators at the Westmead Institute for Medical Research to represent examples of potential uses for phage therapy. I'll go through practical and logistic challenges, as well as outstanding clinical and academic questions, and in particular, the importance of companion diagnostics and therapeutic monitoring, as well as some future directions for phage therapy research, which will be outlined. At the end of the lecture, I'm hoping most of the audience will go from being curious skeptics to avid enthusiasts of phage therapy.